Good afternoon. Good afternoon. My name is Kesia Mariam John. I am your interlocutor for today's speaking subtest conducted at Tiju's Academy on 19th March 2025, and the interlocutor number is 204521, and the candidate name is Anju Susanna Thomas, and the candidate number is 204581. Can I have your ID, please? Here it is. Okay. Thank you. I'm going to ask you some one question. Please note that it won't be assessed. It is just to familiarize with each other's voices. Shall I proceed with that? Yes. Okay. Introduce yourself. I am Anju. I'm from Alapura. I've completed my BS in Nursing from Rajiv Gandhi Institute of Medical Science, Bangalore, and I have 2 years of experience in OT. And currently, I'm looking for better opportunities to upgrade my skills and knowledge. Okay. What do you think about your profession? Well, thank you for asking this question. I love my profession. My mother was a nurse, and her stories inspired me a lot. And that's the reason why I chose this profession. This profession gives me a wide variety of opportunities, both in native and abroad. And this profession helps me to serve the humanity, and I'm in love with this profession. Okay, if a person is not satisfied with your care, how will you manage that situation? Well, first of all, I'll try to communicate with that patient to know what the patient really wants and try to find a solution for the problem. And if it is not possible, I'll try to contact my colleague and I'll seek the help of my seniors. Okay, so do you think that there is any gender disparity in your profession? Well, I don't think that there is a gender disparity in my profession. Well, before this was a female dominant profession, whereas now there are people from both the genders coming towards this profession. So I don't believe that there is a gender disparity now. Okay, that is the end of your bound session. We can start with the first role play card. This is your first role play card, and you have 3 minutes for the preparation, and your preparation time starts now. How may I address a patient during the role play? You can address the patient as Alex. Good afternoon. Good afternoon. Is this Alex residence? Yes. Am I speaking to the right person? Yes. Well, Alex, I'm Anju, one of the registered nurses working in the district hospital, and I'm here to tell you regarding the insulin injection and the information regarding that as per the instruction of your family doctor. So, may I come in? Yes, miss. Thank you for letting me in. Well, how are you feeling today, Alex? Nurse, I'm feeling better. Well, I'm so happy to hear that. Well, do you have any concerns? Yes, nurse. Actually, I'm very concerned about this insulin injection because I don't know. Is it necessary to take this injection? Well, that is a very valid concern from your side, Alex. Well, as per your last routine checkup, your blood sugar level has been elevated. So it is very much important for you to administer the insulin injection in order to regulate your blood sugar level. Am I clear to you? Nurse, I understood what you're telling, but I have been managing my diabetes with the diet and tablets, nurse. Well, I can understand that it is a very valid concern from your side, Alex. I know that you have been managing very well with your diet and medicine, but your recent routine checkup has shown an elevated blood sugar level, which means that your medicine is not helping. So it is very much important for you to start the insulin injection. Am I clear to you? Yes, miss. Okay. Is there anything else worrying you? Yeah, nurse, I understood regarding the insulin medications and all, but I don't know exactly how to take this injection. Well, I can understand that it is a very valid concern from your side, Alex, and I can see that you are a bit anxious about this. But let me reassure you that it is an easy process and there is nothing to be overly concerned about. There are certain things that you need to take care before the administration of insulin injection. The thing is, it is important that you need to use clean needles, and it is very much imperative that you need to switch the sites of injection. That there are several general sites for the injection, which include upper arm, thighs, and around the umbilicus. Am I clear so far? Yes, nurse. And it is imperative that you need to take care of the needle disposal, that it should be done in a sharp container which will be provided by the community health center. Am I clear to you? Yes, miss. Is there anything else worrying you? No, nurse, I understood everything. Well, it is my obligation to provide you a leaflet on the insulin injection, will give you more details about the administration and other details about the insulin administration. Am I clear to you? Yes. Okay. Is there anything else that I need to clarify? No, nurse. Okay. So I'll summarize what we have discussed. So based on your routine checkup, your blood sugar level has been elevated. So as per your family doctor's instructions, it is important for you to start your insulin injection. And regarding your insulin injection, it is important for you to switch the general sites. And the common sites are upper arm, thighs, and around the umbilicus. And it will be beneficial if you focus on the needle disposal in the sharp container, which will be provided by the community health center. And you can check on the information on the leaflet provided. Am I clear so far? Yes. So I hope I have clarified all your concerns. If you have any other concerns, please feel free to contact me. I am here to help you. Thank you. I wish you a good day. Okay, Anju, that is the end of your first roleplay card. And this is your second one. And for the second roleplay card, your preparation time starts now. Good afternoon. Good afternoon, nurse. Please be seated. Thank you. I'm Anju, one of the registered nurses working in this General Practitioner Clinic. How may I help you? Nurse, actually, I came here because yesterday I was experiencing some kind of symptoms and doctor advised me to do some blood tests. Today I came here to collect the blood test report. Oh, well, I'm so sorry to hear that. Well, for my confirmation purpose, could you please tell me your name and age? Yeah, my name is Peter and I'm 18 years old. Okay, Peter, let me check in the system. Okay, as per your records, I can see that you have done certain blood tests yesterday. From your report, I can see that your hemoglobin level is a little bit low, and that is the reason why you were experiencing some kind of uneasiness yesterday. And I can see that you are suffering from a condition known as anemia, which is completely manageable. There is nothing to be worried. Am I clear to you? Nurse, actually, from your words, I'm very worried and there are concerned regarding my condition, nurse. I can really understand what you're going through, but let me reassure you that there is nothing to be alarmed about. This condition is very common and it is easily treatable. Am I clear to you? Yes, nurse. Okay. Do you know what this condition is? Nurse, I have heard about anemia, but I don't know exactly what it is. Well, it is my obligation to let you know what anemia is. Anemia is actually a situation in which there is not enough hemoglobin or red blood cells in the blood. Am I clear to you? Yes, nurse. Well, do you have any idea regarding the treatment options of this condition? No, nurse. Could you please send me that? Okay, don't worry. I will tell you what are the treatment options. It is important for you to increase the iron intake in the diet with foods like red meat or steak. And you can add leafy vegetables like spinach and kale and include iron fortified cereals in your diet. Will you be able to do that? I'll do, nurse, but I don't like eating green leafy vegetables like spinach. Oh, I'm so sorry to hear that, but it is imperative for you to add iron rich food in your diet. Well, I can suggest you to meet a dietitian for dietary advices as well as a course of iron tablets will be beneficial, I think, and it needs to be taken after a meal to avoid side effects. How does it sound? Yeah, Ness, that sounds good. Okay. And in order to get more information about your condition, I can provide you a leaflet about anemia that will give you more idea about how your condition and the management of that. Is that okay for you? Yes, Miss. Okay. Is there anything else that I need to clarify? Yeah, and as you mentioned that I need to take the iron tablet, so how long should I take? Well, it will be included in the leaflet that I have provided. Will that be okay? Yes. Okay, so is there anything else worrying you? No, nurse, I understood everything. Okay, well, let me tell you that it is important for you to come back in 4 weeks' time for another blood test. Is that okay for you, Peter? Yes, nurse. Okay. So, is there anything else worrying you? No, nurse, I understood everything. Okay, so I hope I have clarified all your doubts. Meanwhile, let me summarize what we have discussed. As per your health report, you are suffering from a condition known as anemia, which is completely manageable. For that, some of the treatment options available are you can add more iron-rich food in your diet, and you can eat red meat like steak and add leafy vegetables. Just like you have mentioned earlier that you are not interested in leafy vegetables, you can meet a dietitian for that, and as well as you need to take iron tablets after the meal to avoid side effects. Am I clear so far? Yes. And I have already provided you with a leaflet which will give you a lot more information about your condition. And it is important for you to come back in 4 weeks' time for another blood test. Am I clear so far? Yes. So, do you have any concerns? No, miss. So, I hope I have clarified all your concerns. If you have any other concerns, please feel free to contact me. I am here to help you. Thank you. I wish you a good day. Let us end off your speaking session. Thank you, Anju. Thank you.